President Trump says he's halting the US funding for the World Health Organization for 60 to 90 days as his administration reviews the group handling of the coronavirus pandemic. Trump said the World Health Organization was slow to respond to the crisis and that the organization has been China-centric. First, it is important to get some context. What is the World Health Organization? Founded in 1948, the agency is coordinating authority on international health within the United Nations system. It coordinates activities and provides guidance for their 194 member states and 2 associated members. The World Health Organization has helped eradicating smallpox, a devastating contagious disease, brought life-saving vaccines to millions of children in need of immunization, saved more than 53 million of lives from tuberculosis, and much more. Nowadays, in this worldwide pandemic called COVID-19, the World Health Organization provided technical guidance for health workers on how to take care of patients and guidance to the public on how to protect themselves. How big is the World Health Organization budget? The World Health Organization runs on a 2-year budget cycle. For 2020 and 2021, its budget for carrying out its program is $4.8 billion. Where does these funds come from? For the 18 and 19 budget, 51% of the contributions were from member states, 16% from United Nations and other intergovernmental organizations, 13% from philanthropic foundations, 9% from partnerships, 9% from non-governmental organizations, and 2% from the private sector. These contributions fall in 2 categories: assessments and voluntary contributions. Each member state pays assessment fees based on the country wealth and population. Voluntary contributions have been growing, and for the budget 2021, it is estimated that member states' assessments will only represent 17% of the total budget. How much does the US contribute? The US is the largest single government donor in the world and contributed 20% of the 18 and 19 budget cycle. The US contribution to the pool of assessed fees is $237 million. That's 22% of the total assessed fees, the largest share of any nation. By comparison, China contributes 12% of this pool of money, and some low-income countries pay 0.1%. There are also the voluntary contributions from other US organizations, which pledged more than $656 million for specific programs like the polio eradication. As of the end of March, the US was behind its payment of assessed fees. According to the World Health Organization Statement of Account, it currently owes $198.3 million in membership dues, including some amounts owed for previous cycles. What does a US funding freeze mean? No details have been released on how the funding suspension will be executed. Specialists believe that the US can take away the money that has already been contributed. However, it can instruct agencies such as the United States Agencies for International Development into scaling back cooperation with the World Health Organization. A lot of the voluntary money is provided at the agency level, and the President Trump could demand these agencies to stop providing money for the World Health Organization projects. I hope you have enjoyed the video. If you did, please don't forget to like and subscribe.